Jonh Coombs here from Global Health Clinics. Today I'm with Dr Darryl Turner, a world authority on the endocrine system and in particular the thyroid gland. Welcome, Darryl.
Thank you, John.
Darryl, would you like to give our listeners just a bit of a background on the type of work you do and in particular the benefits for people from the work you're doing?
Sure. I specialize in hormones, in particular the thyroid, because a lot of people have hypothyroidism and it goes undetected. I developed methods of testing and the medications to deal with hypothyroidism very, very effectively. That's 98.5% accurate.
That's quite remarkable. I understand the mainstream medical environment, the testing system's only about 60% accurate.
Or less, yes, because only 18% of the hormones can be found in the blood. The standard medical procedure is to test for blood. In fact, many years ago, before the blood test, they used to rely on a thing called reflexes and symptoms. They then went to the blood test, but the blood tests are not very accurate. According to Dr. A.J. Bayliss, a renowned endocrinologist from the UK, and endocrinologist to the royal family, and head of the Endocrinology Society and the Lister Hospital, he simply states, and he stated this in 1971, that none of the blood tests are accurate for determining thyroid function. The only things that were accurate were symptoms and reflexes.
So your system involving the Thyroflex equipment, that's a reflex process, is it?
Yes. We get this patient's symptoms and we do this on a symptom survey that's very well recognized by all the endocrinology societies around the world. We then measure the speed of the neurotransmitters, the speed of the reflexes, and the resting metabolic rate. We then put all that together with the symptoms and we come up with a definitive answer on whether you are hyper, hypo, or euthyroid. Not only that, the dosing of patients used to be let's try it here and let's try it there. It was just a big guessing game. We've taken the guessing out of dosing a patient for thyroid. So a lot of you patients out there who are on thyroid may not be on the correct dose or the right type of thyroid.
So you've got very accurate system. You said 98.5%.
Yes. So the Thyroflex is a very, very accurate way of determining if you are, mainly if you're hypothyroid. Very few people are hyper.
Would you explain the importance of the thyroid, or what the thyroid is, the importance of it, and the difference between hyper and hypo?
Okay, then. It's a lot better to be hyper than hypo, but the majority of people are hypo. According to Broder Barnes and Terry Hertog, the number 1 and number 2 leading thyroid experts in the world, about 80% of the population in developed countries are hypothyroid. Now, I'll just give you some of the symptoms so that you know what hypothyroid involves. Your muscles are weaker, you feel cold. In other words, your fingers, the tip of your nose, and your toes are constantly cold. You can, even in summertime, you find people wearing gloves or cardigans or pullovers to keep them warm when everyone else is walking around in a shirt. And that is a fairly indicative pointer towards having a low resting metabolic rate, and that is why your fingers, hands, and nose are cold. Your memory is poorer. You get more depressed. Your mood changes easily. And it has a major effect on the brain. In other words, your thinking slows down besides having a poorer memory. You have more difficulty with math, and you have an unsteady gait. In other words, as you walk through a room, you will bump into things fairly easily, bump into doorways. And this is just a few. You get joint pain, muscle pain. Your sex drive drops. You get puffy hands and puffy feet. In other words, you got to take your rings off in the evening, and you have a little bit of difficulty getting your rings off. This is the big one, visual one. you look at the outer third of the eyebrows. If the outer third of the eyebrows have thinned out or have disappeared, you're hypothyroid. And for the females out there, your periods are more irregular. They should be 28 days, 28 days, 28 days. So the 29 or 30 or anything around about that, that is caused by thyroid, because thyroid controls your estrogen and your progesterone, and also controls the type of period that you have. In other words, it can cause clotting or cause your period to last for more than 3 days. You get a hoarser or a deeper voice, constipation, weaker muscles, you sleep more than usual, and you can get very tired, sluggish, and lethargic. Your hair dries out, and it just goes on and on and on. For hyper, you get skipping of the heartbeat because your thyroid controls your heartbeat. In other words, the number of beats per minute that your heart beats is controlled by your thyroid. Therefore, we know that people who are hyperthyroid have a slow heartbeat. People who are hyper have a faster heartbeat. They can also have skipping of the heartbeat and rapid or regular heartbeat, shakiness, increased sweating, brittle nails, loss of appetite. So people with hyperthyroid tend to be very slim, while people who are hypothyroid tend to put on the 3 spare tires, that is, in between the thighs and under the breast. We get 3 bulges of fat. That's very, very difficult to lose. So the thyroid controls your weight.
It's been called the master gland, has it?
Yes, yeah, it is the master hormone gland, and hormones control the quality of your life. If your thyroid is a little bit out, the quality of your life deteriorates. I mean, people do not like to be tired and sluggish. They find it difficult to get through the day, and quite often these symptoms are totally ignored by the average GP. In fact, if you go there and the blood tests appear to be right, but you have all the symptoms, you have the symptoms of something, they've created a special category for this. It's called subclinical hypothyroidism. By definition, that means that you have all the symptoms. You do have hypothyroidism, but the blood tests don't match up. And the blood tests never will, because, as I said before, only 18% of the hormones can be found in the blood at any one time.
So briefly explain what the Thyroflex equipment would be doing.
Sure. It's a 3-minute. It's a very simple 3-minute test. We find a very specific reflex point called the brachioradialis. We then hit that a number of times with a reflex hammer, and we have a sensor on your hand that actually tells us the neurotransmitter speed. In other words, the speed at which the message goes up to your brain, the brain processes it, and it comes back to activate the reflex. We then measure the speed of the reflex. In other words, the hand will move up and down, and you may have seen this in a more classical way, done on the knee, where a doctor will take a reflex hammer, he will hit your knee and he will judge it visually. Well, we actually judge it very accurately with modern day sensing devices that gives us an exact speed of the reflex and the neurotransmitter.
So this sounds like a condition that you said 80% of the Western population is dealing with this sort of problem.
Yes, yeah, and most of it goes undetected. In fact, if you don't address thyroid and you are hypothyroid, it shortens your life expectancy. But now listen to this. This is why we want to treat people, and why I'm very proud to have invented and developed the Thyroflex, in that we can halve your chance of getting Alzheimer's. That's one half. Reduce it by 50%, because 50% of all Alzheimer's, that is a deterioration in the brain. And we just covered some of those symptoms before, which is poorer memory. Your memory's just not quite so good, more depressed, mood changes easy, slower thinking, difficulty with math, and unsteady gait. and that is you bump into things, and sometimes we can pick it up if you don't get it treated, and you start to get a little bit of a tremor. That's shakiness is very easy for us to check that out. But not only do you double your chance of getting Alzheimer's, but you get a 70% chance of getting all the Parkinson's-like diseases, all the shaking disorder and diseases. And that's all caused by hypothyroidism.
Would that include dementia?
No.
So dementia's in a different category.
Yes.
What else might be affected, Darryl?
Well, a lot of people with headaches, the high blood pressure, low blood pressure, a thing called sudden death, where people don't die of heart attacks, but they just suddenly die. The heart stops beating because, as I said, the heart is regulated by the thyroid. All the vascular and diseases, that is the thickening of the arteries or the narrowing of the arteries. The big one, these are some of the big ones: diabetes, cancer, and bipolar disorders, schizophrenia, depression, joint effusion. That is where the joints start to swell, carpal tunnel, and all the myalgias.
Really?
As well.
That's why it's called the master gland.
Yes.
How easy is it to treat?
Very, very simple to treat. We do a survey. If you score more than 8 on our symptom score sheet, we test you. The test takes 3 minutes, and we can determine right there and then if you need to go on to natural bioidentical thyroid medication. If we do put you onto thyroid medication, we have to adjust the adrenals, make sure the adrenals are working properly, you have enough iodine and iodide, and that your sleep is right. In other words, we have to make sure that your melatonin, serotonin, tryptophan, and magnesium are in balance. These are actually, in a woman, controlled by the estrogen, and if the estrogen drops too low, and which is in turn controlled by the thyroid, you start to get sleep problems. And we make sure that you have enough stamina.
So it's a fairly good integrated program you've got going.
Yes, yeah. So if we treat your thyroid, we have to treat the core hormones. This is what we call the core hormone program. So it covers thyroid, DHEA, D3, pregnenolone, GABA, the Bs, the adrenals, iodine, iodide, melatonin, serotonin, tryptophan, magnesium, CoQ10, and the ACTH.
But it is actually quite a simple program once you know what you're dealing with.
Yes, yeah. A complete session only takes 15 minutes, and it changes your life. In other words, not only does it increase your life expectancy between 6 to 8 years, but it also avoids you getting diabetes, Alzheimer's, and all those other risks that I just mentioned. And that were just a few of the long-term manifestations of misdiagnosed or undertreated hypothyroidism.
Darryl, we're going to take a break now. We're going to come back and we're going to go into a lot more detail. We're going to discuss cancer in more detail. We're going to discuss IQ in more detail. And we're going to discuss the whole iodine, iodide in just a little more detail. Thank you very much.
Thank you, John.